Kogi seems to be among the 6 states in Nigeria that have mild cases of cholera, recording only 2 confirmed cases. The State Commissioner for Health, Dr. Abdulazeez Adam, who disclosed this in Lokoja, said cases were confirmed with 1 victim treated and discharged. Adam said that he was aware that 31 states, including the FCT Abuja, had epidemic level of cholera, which is of public health importance, meaning the remaining 6 states may have, but not to epidemic level. On measures taken by the state governments to address the situation in the state, he said drastic measures have been taken to ensure that the disease is brought under control. To get better perspective on this case in Kogi State, we're now joined by the Commissioner for Health, Dr. Abdulazeez Adams. Dr. Adams, thanks for joining us. So far, Kogi has not recorded many cases. Could you expatiate a little on the measures that you are taking to ensure that the figure does not rise?
Good evening and good evening, Nigeria. Thank you for having me here today. Cholera is an acute bacterial infection that can affect any age group. Currently, in Nigeria, we have an outbreak of cholera. And recently, because of the confirmed cases we have in Kogi State, we can say Kogi isn't left out in the outbreak. For now, the state has embarked on several activities being supported by the COPREP, which is a COVID-19 preparedness program that we carried out in the state over the last 5 to 6 months. It's actually involved preparing a state on how to respond to infectious disease outbreak. This was born out of the COVID-19 that ravaged the entire world. So this has made Kogi State, amongst other states, to train people on how to respond to infectious diseases. A couple of months ago, Kogi was among the states that was also ravaged by Lassa fever virus. And because of this training that we've had in Kogi State, it has prepared us against further outbreaks. This involved training lots of health workers, some lab focal persons, disease notification surveillance officers, even community health workers, community mobilizers were all engaged and trained them on how to search for disease outbreak, on how to report this disease outbreak. As I speak to you, even before the outbreak of cholera, all these health workers and a host of others have all been trained on alert for any possible outbreak of any infectious disease. Until recently, we had cholera. The cholera outbreak, of course, affected Kogi State, and the confirmed cases we have involve 2 local governments. One is the state capital, and the other local government is not the state capital. These officers have been trained across all the 21 local governments and across all the 239 political wards in the state, kept them on alert. That is why the other case that was recorded was far away from the state capital. These, our active officers, quickly recognized that case and then notified the state government, and the case was managed in the local government where we found the case.
Okay, I was going to actually ask you about the job of these disease surveillance and notification officers, but you've explained that a bit. We've also talked about the fact that the government has trained people on how to identify cases that you termed in previous reports as epidemic because of your experience with Lassa fever. Could you briefly, again, explain what to look out for as signs, especially for people in rural communities?
All right. As part of effort in sensitizing the community, we're engaging everyone, including the Ministry of Information, in sensitizing everyone on what to look out for to suspect a case to be cholera disease. Cholera largely is a case that has the common symptoms of vomiting and passage of loose stool. Even though the loose stool associated with cholera has a characteristic feature of what we call rice water stool. However, because of the current outbreak we're facing, anybody with complaints of passage of loose stool is expected to present him or herself to the nearest hospital facility for there to be thorough assessment and test to confirm whether it is cholera or not. This we're doing is sensitizing everybody down to the communities, urban and rural places, on the need to have good hospital-seeking behavior. Because, again, we advise people to generally have good health-seeking behavior by going to hospital whenever you have any complaint of ill health, rather than sit at home and start making calls or sit at home and be using measures that are not medically proven to be helpful.
Talk to us about open defecation and drinking of bad water, especially for rural communities whose source of water, for instance, is the stream. Even in today's society, we know that there are communities like that still in Nigeria. Do you have such communities, and what are you doing to get to them? Because one thing is to say we're talking on radio, we're getting these officials. Well, is that information getting to those at the very low radar of society?
Yes, like I mentioned earlier, amongst measures that are being advised to use to prevent cholera is to drink potable water. Even when it is not available, get the water, boil, and allow it to cool and drink. Wash hands regularly, cook food with clean water, keep our food clean, and then maintain good hygiene.
Yeah, yes, you've said this. I'm just asking.
Yes. And getting to the rural communities, I made mention of those that were trained. I made mention of community mobilizers, community engagers, rural community leaders. These people have been trained. And as I speak to you, even the traditional town mobilizers, town announcers, the one we usually call town criers, they are actually referred to as town announcers. These people have been engaged currently in Kogi State. They have been trained and they are going around rural communities where they do not have access to this radio or even flyers. These town announcers have been engaged in rural communities, in marketplaces, and even where they have their community meetings, or even in traditional houses, or even religious homes where people come to mosques or churches. They have been encouraged you have been trained to educate people on these measures to carry out and in preventing the cholera. So we are reaching out to rural places across all the 239 wards and even villages in Kogi State.
We certainly hope that your efforts will pay off and the figures will remain low in Kogi State. Just to reminisce and say, it's been a long time I heard about town criers. I miss hearing them make announcements. Thank you very much for reminding us and for speaking with us.
Thank you.